Hello everyone and welcome to Clarteis webinar. I'm Ibrahim YOUSSEF, Clinical Director at Clarteis. Today I will explain to you how Exciplex make the dermatology practice complete. I will share with you all the features of this innovative and unique excimer light and how it treats vitiligo, psoriasis, alopecia areata, and other autoimmune skin diseases. Exciplex has been developed by Clarteis in France 3 years ago. And today, more than 30,000 treatments have been done all over the world. Moreover, the clinical efficacy and the safety of Exciplex have been proved in 2 clinical studies, in segmental vitiligo and in resistant alopecia areata. So, of course, we can share with you those clinical studies. And I will talk in details about them later in this presentation. Before talking about Exciplex and about this unique product, I will come back and talk a little bit about the monochromatic excimer light. So the monochromatic excimer light is a form of targeted phototherapy that delivers a specific wavelength, which is 308 nanometer. It can be laser or lamp. So what is the difference is that in laser, as you can see here, all the photons go in one direction. That's what we call the coherent line, and it will result in a small spot size. However, when it comes to lamp, the photons go in all directions. And that's why in excimer lamp, we have a big spot size. Several clinical studies tried to compare the excimer lamp and the excimer lasers and found out that the excimer lamp and the excimer laser have the same clinical efficacy. For instance, in these clinical studies where the author were comparing the repigmentation score when in the treatment of excimer lamp in gray and excimer laser in white. And as you can see here, and the author concluded actually that there is no significant difference in the clinical efficacy between the excimer lamp and the excimer laser. All the other clinical studies also that we could find on PubMed concluded that we have the same clinical efficacy when it comes to excimer lamp and excimer laser. However, excimer lamp are more convenient than laser thanks to the cost, ergonomy, the space, that excimer lamp are small, no need a big space to store it. So all those advantages make from excimer lamp a more convenient device. It was proven, and it is proven that it is very efficient, but how it works? Here I show you a photo, an image of the skin layers. So the epidermis, the dermis, and the hypodermis, we didn't show it. What's good to know, what is important actually to know, is that the 308 nanometer, so excimer light, it stays in the epidermis and will act directly on the Langerhans cells, the keratinocytes, the melanocytes, and the lymphocytes and dendritic cells. So it will inhibit the epidermal keratinocytes in terms of, for example, in case of psoriasis. It will act also on the melanocytes in case of vitiligo. It will alter the antigen presenting cells activity. So it will induce also the T cells apoptosis by reducing the immunoresponse. So as a conclusion, what we need to understand and remember for this presentation and for also to know how it works, the monochromatic excimer light act as local immunosuppressor and local immunomodulator. It has been proved scientifically and clinically that 308 nanometer is the best wavelength to treat vitiligo, psoriasis, and alopecia areata. And in fact, there is more than 200 clinical studies published. And the author of those clinical published concluded that the excimer, which is 308 nanometer wavelengths, it is the best to treat the lymphocytes. And the apoptosis induced by the excimer light is much more important than this induced by the narrowband UVB, which is the conventional phototherapy. When it comes to monochromatic excimer light, we need less number of sessions. So we can see the results much faster compared to the narrowband UVB. Which is good also to know about the monochromatic excimer light is the ergonomy, because it's handheld. We can have it as a handheld excimer system. So we can easily reach areas such as genital. We can also easily treat the eyes, which is not the case when it comes to narrowband UVB. All that to remember also that the excimer light is a targeted treatment, is a targeted phototherapy. So we only target the affected area and we protect the healthy skin. And this will result in decreasing the risk of the skin cancer on the long term. Here I share with you all the characteristics of Exciplex, this unique and innovative excimer light with a patent to protect our technology as the most powerful handheld excimer light in the world, with a total power of 2,500 milliwatt and affluence of 100 milliwatt per centimeter square. It is CE and FDA, and it's made in France. It has a big spot size of 5 × 5, so 25 centimeters square, but also you can reduce it depending on the area that you need to treat. We have two types of adapters. So those that you can fix it directly to the device, and the other, the silicone masks that you put it on the skin and you protect in this way the healthy skin. Exciplex has several indications. It's a versatile device. So in CE mark, we have vitiligo, psoriasis, alopecia areata, mycosis fungoides, and atopic dermatitis. And in FDA, we have as approval for vitiligo, psoriasis, atopic dermatitis, and leukoderma. So let's start to talk about vitiligo and how Exciplex and excimer light work in vitiligo. What to know about vitiligo, so it is the lack of melanin in the skin. With the excimer light, actually, we will stimulate and we will optimize the melanogenesis. So we will increase the production of melanin. How? First, there's two ways. The first way is that we will stimulate the migration of the melanocytes from the healthy skin to the affected area. And the second way is by follicular, perifollicular. So we will stimulate the melanogenesis from the hair follicle. So we will activate those melanocytes that are present, that they are in the hair follicle to produce more melanin, and that's what will give the skin color back. Moreover, several clinical studies showed that the excimer light radiation increase the factor endothelin-1, which is secreted by keratinocytes, and also it increased the vitamin D synthesis, and those two factors actually are important in the melanogenesis. With Exciplex, it's very easy to use as a device, and of course we give the clinical protocol. So this clinical protocol depends on the dose, which is the single parameter, and it depends on the area where we want to treat. For example, in periocular and genital area, we start with 50 millijoule per centimeter square, and in fingers, toes, we can go up to 400 millijoule per square centimeter as a first initial dose. And then for the next session, we increase the dose depending on the skin response. For example, if there is no erythema, we increase by 50 millijoule per square centimeter. If there is a good erythema, we keep the same dose. And if there is a big erythema, we decrease the dose, or if there is a hyperpigmentation, we postpone for the next sessions until the 20 sessions or 25 sessions. But after a couple of sessions, in this case, 7 sessions, we start to see the evolution of the pigmentation. And that actually is very encouraging and motivate the patient to continue the treatment. On face, 100% of repigmentation, in this case, after 17 sessions. Even on the neck, which is a resistant area to treat in vitiligo, it can goes up to 6 months of treatments. But as you can see, almost 100% of complete repigmentation. And that actually, I met the patient, it is in France, and it was amazing experience for her and how Exciplex changed her life. On neck, again, in this case, after 12 sessions, on localized patches is very efficient after 15 sessions. On the axilla, even on knees, which is a difficult area to treat, after 20 sessions, of course, in this case, you continue the treatment and you will reach 100% of repigmentation. In this case, on face, after 4 sessions, I wanted to show it to you to tell you how the production of melanocytes and how the pigmentation evolves between the first and after 4 sessions. So in this case, as you can see on the nose, for example, we started to see 100% of complete repigmentation in this area. Or even if it comes, you can see it, for example, in this here, in this area, on eyes. So all this actually are very motivating to the patient to continue the treatment. Of course, I would be very happy when I will take the last sessions. I will share it with you, and I will let you see how many sessions it needed to complete the treatment in this case. Even on elbows, which is a difficult area to treat, and resistant patches of vitiligo, after 6 sessions in this clinical results, which is actually spectacular. It's amazing results, great results after only 6 sessions. For resistant patches of vitiligo and as segmental vitiligo, such in this case, some doctors combine Exciplex with fractional laser CO2. And actually the results are amazing because after 10 sessions, you can see the pigmentation, the beginning of the pigmentation, only 10 sessions. And even you can see here, the hair is white. And in this case, after 10 sessions, we gave even the color for the hair. So we are producing more and more melanocytes and more melanin. It's amazing results actually after 10 sessions. The same for this patient in this area. You can see the vitiligo patch. It's very resistant patch of vitiligo, and the doctor combined Exciplex with the fractional laser CO2 after 11 sessions. Even on acral vitiligo, which is today the most challenging case for doctors and for patients, because most of the patients would like to see results on acral vitiligo, and the doctors would like to give a solution for those patients. And we are working with some doctors to see if we can combine the fractional laser CO2 in the case of acral vitiligo. And actually, I want to share with you this results, which I'm very happy to see it, to show you how the pigmentation evolved actually after only 6 sessions. So as you can see in this area in red, before and after 6 sessions, even on all fingers. That is amazing. Only 6 sessions needed when it combined with the laser CO2. Or also some doctors for resistant patches, they combine it with microneedling, and it gives also very, very good results. So now we talk about psoriasis and how excimer work in psoriasis. So as I said in the beginning of this presentation, the excimer will induce the apoptosis of, or will reduce the hyperproliferation of the keratinocytes, and it will induce the apoptosis of the T cells. So this is the general mechanism. And also some clinical studies show that a high dose of the excimer light, that's why the power also is very important when it comes to psoriasis, and the energy delivered is very important. And in case of any type of psoriasis, the high dose of excimer light reduces the number of pathogenic memory T cells, infiltrating both the epidermis and dermis in psoriatic lesions. So that means to reach a fast treatment, a high energy delivered to the psoriatic lesion is very important. And also clinical studies showed that 84% of patients achieves more than 75% improvement after less than 10 sessions. So now I will show you how the excimer light induce the apoptosis of the keratinocytes and the T cells. So in this clinical study, we are studying the expression of the author studied the expression of the keratinocyte 67, which is represented in red point. And this was before the treatment of excimer light. This was after the treatment of excimer light. So you can clearly see the apoptosis of the keratinocytes. But also you can see the skin actually here in the psoriatic lesion, it was very thick, and how the excimer light also reduced this thickness of the skin. As I said, it works also as it will induce the apoptosis of the T cells. So it works on CD3, in CD4 plus, and CD8 plus. As you can see it before monochromatic excimer light and after the treatment of monochromatic excimer light. So all that to prove actually that excimer light is an efficient alternative solution for psoriasis. With Exciplex, we give this as a protocol for psoriasis, which depends on the MED, so the minimum erythema dose. In the program of this protocol, there is three estimation test for depending on the skin phototype. So you do the MED at the first session, and 24 hours you read the results, as you can see it here. So the concept is that you will do 6 doses from the lower to the highest, and this test will help the doctor to identify the ideal dose to start the treatment. So in this case, for example, it is between 4 and 5. So then you follow the clinical protocol that we give. The initial dose is 2 times the MED. So supposing that in this case it was 250, the initial dose is 500. And for the next sessions, if there is no erythema, you increase the dose by 0.5 MED. And if there is a big erythema, you decrease the dose. Or if you have a good erythema, you keep the same dose. Maybe you will look at this table and you will say, wow, it's complicated, it's math and how we need to calculate it. But please, trust me, it's very easy. It's intuitive. Thanks to the screen of to the interface of Exciplex. So as you can see here, you can put the MED, which is fixed, and then you only change the multi. So you start with 2 times the MED, and then if there is no erythema, you increase only the multi by 0.5 for the next session. For the third session, it will be 3, and so on. So it's very easy actually. And here with a minus and plus, you adjust it. So you can do 3 times per week as a treatment. A complete treatment is between 15 to 20 sessions. It can be combined with topical treatments and corticoids. And actually, as in case of vitiligo, it gives the faster results. So here I'm showing you some of clinical results. This clinical result, which was a resistant patch of psoriasis after 13 sessions for localized, and even for thick patches, it's very efficient. It needs only 13 sessions. Even on scalp psoriasis is very interesting because 80%, almost 80% of psoriasis patients have scalp psoriasis, and it's difficult to treat. It's itchy and it's not really very comfortable for the patient. And today with Exciplex, we are offering a new solution, a new alternative solution for this type of psoriasis. And as you can see, as here in this case, it was monotherapy. So after 15 sessions, you can see that we completely cleared the symptoms of scalp psoriasis. So that actually is amazing by offering this new solution and this new alternative solution, if I would say it. So for localized patches again, in ankles, in this case, 13 sessions. Again, scalp psoriasis, severe case of scalp psoriasis. So here we changed actually the life of this patient, the quality of life of this patient after 4 sessions only. That is amazing. Again, in scalp psoriasis, after 12 sessions, even on large area, for example, on random patches on the back, you can see it's also comfortable to use because with Exciplex is very fast actually, delivering 100 milliwatt per centimeter square. So for one shot is like 3 to 5 seconds, which is very, very fast. And here after 3 sessions, almost complete treatment. Even on severe case of plantar psoriasis. So this case actually, the doctor told me it was very, very resistant. No other treatment gave results. So the doctor decided to use Exciplex, and actually the results were, Dr. Amira Jamal was surprised with this results that after 10 sessions, it's amazing. And now she is continuing actually the treatment, and the patient is very, very, very happy because no other treatment gave results. And by using Exciplex, so Dr. Amira Jamal offered a new alternative, which will make the patient very satisfied. Now we talk about alopecia areata. So how alopecia areata occurred and how excimer light work in this case. So in the case of alopecia areata, we'll talk about the normal anagen phase in the hair cycle. You can see that the hair follicle actually is immune privileged. There is no APC, which is antigen presenting cells, and the major histopathology complex is only on the surface. There is no CD8 plus, nothing. In case of alopecia areata, actually, the hair follicle, in the hair follicle, you can see the overexpression of the T cells, CD4 plus and CD8 plus. And you can see also that we break, actually, it has the immune privilege of the hair follicle was violated, and which leads to the hair loss. This leads to the hair loss, and the T cells are a factor very important in this process. So how it works, the monochromatic excimer light alters, in the beginning it will alters the antigen presenting, the antigen presentation. So it will reduce the immune response, and in the same time, and it will induce the T cells apoptosis. So here, those T cells that are responsible of the hair loss will be killed, and then we will cure the symptoms, and we will start the hair regrowth. So with Exciplex, it's very easy to use it. We have only single parameter, which is the dose. So you start the initial dose with 200 millijoule per centimeter square, and then depending on the skin response, you increase the dose. You can do up to 2 times per week, a complete treatment, 15 to 20 sessions. So it's very efficient and solution as monotherapy after 18 sessions. As you can see here, almost 100% of hair regrowth. Sometimes it's 7 sessions. It's amazing, actually. Also 7 sessions in this case. And on resistant patches of alopecia areata, as I showed you in the beginning, this was the clinical study by using Exciplex. So resistant patches of alopecia areata, which means that no other treatments gave results. And with Exciplex, you can see that after 24 sessions, in this case, we have up to 100% of hair regrowth. This also the second clinical result. You can see the evolution after 8, 16, and 24 sessions. Of course, here you continue the treatment and you will until you reach 100% of hair regrowth. Again, this case, very resistant case. And also in marginal alopecia areata, which is very resistant. So here you can see that after 24 sessions, we achieved almost 50% of hair regrowth, but actually that is amazing result. And you can continue, as I said, you can continue until you reach the 100% of hair regrowth. But that is amazing because, as I mentioned before, that those cases are very resistant and no other treatment gave a result. That's why we tried Exciplex, and it works perfectly, actually. So what to know and what to understand thanks to this presentation. So we talked about the excimer, and we said, and we proved actually, that the excimer light and the 308 nanometer is the best to treat vitiligo, psoriasis, alopecia areata, and other autoimmune skin diseases, such as atopic dermatitis or localized patches, early stage of mycosis fungoides. We showed also that the excimer lamp and the excimer laser have the same clinical efficacy, and this efficacy is superior to narrowband UVB1. So with excimer, you need less number of treatment compared to the conventional phototherapy narrowband UVB, and you will have faster results. Exciplex work as immunosuppressor and immunomodulator. It induces actually the T cells apoptosis. It is very efficient in all cases of vitiligo and alopecia areata, psoriasis, but more specifically in resistant patches of vitiligo, like segmental vitiligo and resistant patches of alopecia areata. It is safe and painless. So it is a device that completes all the dermatology practice, and it makes the patient very satisfied when it comes to resistant patches, because it will give better results and faster results compared to all the other treatments. So thank you for your attention. And if you have any questions, of course, I will be very happy to answer it. You can type it and I will see it, then I will respond. And by the way, a recorded version of this presentation will be available in the next few days. Thank you so much. Okay, can we use it for children? Yes, Dr. Amani, we can use Exciplex on children. Actually, as a recommendation from Clarteis, we don't recommend to use it on children less than 15 years old. But as you could see in the clinical results, most of doctors use it on children, and they have amazing results. Of course, those are under responsibility of the doctor, but most of doctors that use Exciplex knows that it is very safe and there is no problem. Regarding alopecia universalis, yes, some doctors also use Exciplex combined with corticoids to treat alopecia universalis. I can actually I have some clinical results that I can share it with you for the alopecia universalis. So if you can see in this case, for example, from Dr. Dalia, this was after 5 sessions. It's actually quite unbelievable, this result. After 5 sessions, it was complete hair regrowth, even on eyebrows and the beard. So actually, it's amazing results in this case of alopecia universalis, but again, it's combined with clobetasol and minoxidil. It's not alone. We have also this result, which is the same combination treatment. Another results for alopecia universalis. So you can see that after 4 sessions, complete hair regrowth. Again, it is combined with clobetasol and minoxidil. So yes, we can treat on alopecia universalis. I didn't talk about it in this presentation. It's because this indication doctors can use it, but as Clarteis, as we have only alopecia areata recommended, so we preferred actually to only communicate on alopecia areata in this presentation. But of course, as you can see with those results, we can combine with any corticoids, and we will get amazing results for alopecia universalis. During pregnancy, we don't recommend to use Exciplex for pregnant women. It's not recommended. And if we want to combination between UV and of course you can combine UV and Exciplex, but at the end, for what to do with this combination? What we need to understand is that, of course, we can combine both of those technique, excimer light and UV narrowband. In case of cabin, for example, if we have vitiligo or psoriasis patch on all the body, it's easier to go to the clinic and to do the treatment with the cabin, with the cabin of UVB. And after this, if in most of cases, actually, we have resistant patches. So in this case, we combine the Exciplex, and we do the treatment with Exciplex, and we have amazing results. And by the way, there is also a clinical study talking about the combination between narrowband UVB cabins and the excimer light for resistant patches, and actually it works perfectly. So even if you have a cabin, it can also be a very good complementary device to offer a solution, a complete solution treatment for patients. Any studies about treatment failure? Yes, of course. We don't have 100% of patients that respond to the narrowband to the excimer. It will be more than let's say in some cases, actually, in some cases we have in vitiligo. Let's take some cases of vitiligo. Some studies showed that 60%, around 60% of vitiligo patients can respond to the treatment, and they have 100% of repigmentation. And again, the percentage of repigmentation also depends on every case. So we can see some patients that they don't respond, and in this case, we can combine the treatments, as we could see, for example, for acral vitiligo, which is very difficult area to treat. So when you combine, maybe we can reach a good results. In case of psoriasis, some doctors actually, they are doing maintenance, a post-treatment recommendation. So here it comes the next questions about the post-treatment recommendation. So some doctors actually, they are doing a maintenance test. And this maintenance test is to keep to eliminate the risk of recurrence, actually. So this risk of recurrence, how they avoid it? They do a maintenance test, which is for one session after the treatment. Once we get 100% of complete treatment, you do one session every 2 weeks, then you do one session every 1 month, and then you continue every 2 months, one session, 6 months, and after it is 1 year. So it's just the space between each session will be much longer, and that will prevent from the relapse of the disease. So this is the only post-recommendation treatment that we can say it. And we can, what is the precaution after the session? So with the examer, we don't have precaution after the session. It's still, since we don't use any gel or any cream during the session, we don't have the risk like, for example, I will give you the PUVA, for example, you use psorilan with the UVA, so you have to avoid the sun after. But with excimer, there is no precaution for after the session. You can do the session and after you go, and there is no problem. You can continue the life, your daily life, and like nothing happened. What is the maximum dose for eyelids? Again, the maximum dose, it's difficult to answer actually, and to know what it is the maximum dose. But since we have an erythema on eyelids, we keep the same dose. What I mean by erythema, which is the homogeneous redness. When we have this erythema, we keep the same dose. We don't need to do a higher dose. So as an answer for this question, I will say it depends on each case, on each response of the skin, but a maximum dose, we cannot say it. We can say that we can start with the minimum dose to stay on the safe side, and we increase a little from one session to another. And if we have this erythema, we keep the same dose until we get 100% of repigmentation. Maximum dose for foots, so those area, foots, elbows, hands, they are very resistant, so we can go up 500 or 600 millijoule, or you can do an overlap actually. So you can do 400 millijoule in one shot, then you can do it 3 times on the same area. So at the end, you can give, for example, 800 millijoule also, or 1000 millijoule for this area, and sometimes they are very resistant. So as a maximum dose that we can deliver, there is no one answer actually. That it depends on the skin. Can we take sun baths during Exciplex treatment? Yes, and that actually is a good thing. If you go to take a sun bath after Exciplex, that will help to activate the melanogenesis, because as we know, the UV, also the phototherapy, which is the UV, the exposure of the UV, and in the sun we have this UV. So when you go to the sun, a lot of doctors even recommend to go to take sun baths after Exciplex treatment, and that is especially in those countries where it's very hot and there is sun. So yes, you can take sun baths during Exciplex treatments, and it's actually, we recommend it to improve and to get faster results. Is the maintenance recommended for all application? Honestly, there is no clinical studies talking about the maintenance protocols. That is only by experience from doctors that share with me this information. Some doctors recommend to do the maintenance for psoriasis because the recurrence in case of psoriasis is much higher than vitiligo and alopecia areata. But again, I cannot say that we recommend this maintenance test for all the application. It's just experience of the doctors. And we know that when we do the maintenance test for maintenance protocol for psoriasis, we don't have relapse, or at least we have much less relapse than if you don't do anything. What is the time do you suggest between Exciplex and CO2 laser, and is there any side effect if we use many sessions? So this combination treatment is the Exciplex plus CO2 laser in the same session. So in the same session, you start with the Exciplex, then you do the CO2, to open the channel and you put the topic cream. We recommend to do this once every 3 weeks, this session. We don't recommend to do it every week, but some doctors actually to combine and to improve the results, instead of doing CO2 laser every week, they do 1 week CO2 laser and the next week they do microneedling. So in that case, you can improve the results. But in any way, the CO2 laser, we use it here and very low energy. So it's not, there is no really side effect about it. And is there any side effect if we used many sessions? No, since we respect this protocol that we don't do the CO2 laser at high energy every week, we don't have really a side effect. Actually, we can do this until the complete repigmentation. How many sessions can we decide as non-responsive case of vitiligo? So in non-responsive case of vitiligo, that is very good questions. Thank you, Dr. Atul. So in this case, we recommend actually, if we don't have any results with Exciplex before 15 or 20 sessions, depends on the area. What I mean, on face, if we don't have results before 15 sessions, we start the treatment, or we stop the treatment, because that means that the skin is not responding. Normally in 15 sessions on the face, we should see the first results of pigmentation, as we could show it actually in our clinical results before and after. However, when it comes to elbows, knees, and those extremities and difficult area to treat, we can go up to 20 sessions or 25 sessions even on foot and hand. If there is no results, we stop the treatment. So the skin is not responding and we stop the treatment. That is our recommendation, because we are sure that before 15 sessions, we will see the results. Microneedling, do you mean RF microneedling or simple dermapen needling? It is only simple dermapen needling, no RF. It's just microneedling, which is the simple needling. And when we do microneedling, before or after? So in the session, in the treatment, you do at first Exciplex, then you do the microneedling, and after microneedling, you put the cream. So the aim of laser CO2 and microneedling is just to open channels that will penetrate, it will allow the good and deep penetration of the cream, and it will help the repigmentation. And of course, also some of doctors, and we can think that the CO2 laser can stimulate the growth factor that will help also the melanogenesis, to activate the melanogenesis. Can Exciplex treatment can be combined with biological drugs? Yes. This questions today, with especially in case of psoriasis, is raised actually, and yes, we can combine Exciplex with biological drugs. And by the way, some clinical studies showed that after biological drugs, we still have we can see resistant patches, and by using excimer light, we cure those patches. So combining Exciplex and biological drugs is feasible. Can we use Exciplex in patient during breastfeeding? This some doctors actually, and on Tuesday, we had these questions also during our webinar, and the doctor said that yes, we can use Exciplex, or he or she use Exciplex in case of breastfeeding, but not in case of pregnancy. In breastfeeding, they recommend. So I don't have a personal recommendation regarding that. I will follow the doctors that they are doing it, and they recommend for breastfeeding. There is not a problem. Which patients maybe don't responded by Exciplex? So actually, it's not. It doesn't depend on the patient. It depends on the case. Most of the case that maybe it will not respond to the Exciplex and to all the Excimer and to all the treatment actually available. It is the case of acral vitiligo. But again, with the combination protocols that we are working on, we can treat those areas. I think that I responded to all the questions. Thank you for being with me and to share with me. Thank you for your time. And of course, a recorded version will be sent to you very soon. So of course, we will send it to our partners in each country, and you can get in contact with them to get this recorded version. Thank you so much, and I hope that this virtual conference could help you and could convince you to know what are the benefits of the Excimer and Exciplex more specifically, and how Exciplex can make the dermatology practice complete. Thank you so much.